Select the most appropriate therapy for atrial fibrillation. Option A, Argatroban. Option B, Candesartan. Option C, Dofetilide. Option D, Nesiritide. Option E, Tirofiban. The correct answer is option C. Dofetilide, a pure class 3 antiarrhythmic agent, was approved by the FDA in 1999 for the maintenance of normal sinus rhythm, delay in time to recurrence of atrial fibrillation/atrial flutter AF/AFI, in patients with AF/AFI of greater. Thank you for watching video. Please subscribe channel and like video. Please click on bell icon in order to get notifications for upcoming videos. Feel free to share videos and channel links.